Well, there's been a lot of discussion about peptide therapy recently and how it can contribute to longevity. Here to tell us more from Changes Plastic Surgery and Spa is Dr. Michael Rossi. Dr. Rossi, of you I have heard many good things. It's nice to meet you finally.
Very nice to meet you.
So tell us, first let's start with the basics. What are peptides?
So peptides are simply little signals that tell the body to produce proteins, and proteins are essentially what create function in the body. So when you take a peptide, peptides been around for hundreds of years. Insulin is even one of the original peptides that's been around for almost 100 years. You take something and then in your body there's a signal that goes off that tells your body to either have stronger skin, hair, nails, to have increased energy, better metabolism, better control of your glucose and sugars. So it's just simply a signal that you're putting in your body to have an end effect.
Do peptides occur naturally in the body?
They do. So peptides are basically optimizing what your body's already doing. So proteins, again, are the signals that create end results. So a peptide is something like insulin, and like I explained in our body, we already have our pancreas that produces insulin. Well, you can take extra insulin when your body doesn't produce enough or your body doesn't react to it well enough. And so it's a simple fact that when you don't have enough of something, you're not producing something efficiently enough, you can give yourself more of that to have a better effect overall.
I see. Yeah. And how do we take peptides? Is there more than one way?
There's multiple ways. There's a lot of controversy and a lot of buzz about peptides because they're not fully FDA approved, some of the newer ones that you hear about. But they're being used off-label and now on-label in some instances to create positive effects. And the most efficient way to take them is through injection. And so it's a small hypodermic needle, similar to an insulin needle, that you inject into your soft tissue. There's also ways intranasal and there's oral methods as well, but there's a lot of different methods being studied. The most tried and true has still been injectable though.
And how about, will this help heal ailments?
So it can. So again, a lot of times, high cortisol levels, for example, not sleeping well, they can make you have issues with not recovering from inflammation or injury. And so there's peptides that can help you sleep better. When you're starting to age, your collagen in your dermis starts to thin, so your skin starts to fade and look older and saggy. There's peptides that can help you thicken your skin, right? There's peptides that can help you with increased metabolism so you can burn fat better. So it's all things that have an end result of enhancing what you're already having your body do. Just the changes that happen with age, this is helping to optimize it and kind of bring it back to a more youthful state.
So it gives your body a boost.
Absolutely.
And it's not FDA approved yet.
So there are some that are FDA approved, there are some that are under studies. A lot of the ones, the most common peptides we're hearing about these days are the GLP-1s, right? So the Ozempic is the term that's used as a blanket term over them. These are FDA approved and they're FDA approved for treatment of diabetes. But then they found as a side effect that, wow, they really help a lot of patients lose weight and they help with more optimized sugar management. So these are FDA approved, but there's a lot of studies being done currently, and with RFK, he's been gracious about looking into this more and seeing about how to optimize our health and loosen some of the handcuffs on these medications. But there are FDA approvals for some, but not all, and so we just have to be very careful about that. And that's why it's important that if you're interested in this, you choose a provider that actually understands these and understands the downstream medical effects and not just buy them on the internet, from unknown sources.
How many different types of peptides are there?
Well, there's between 12 to 14 are the main core peptides that we talk about or you hear about that are being studied for FDA approval that have various functions. But there's countless as far as what you can use out there, and that's why you just have to be careful. Again, I always say to my patients that come in asking about how to optimize their health, I say, well, what are we trying to accomplish? A lot of people I hear and friends in the community that are on peptides from some online source, what they're saying is they're just buying the same 3 that they hear about. But I'm like, well, you need to know what you're trying to accomplish in order to use the appropriate ones for your end goal.
Is there any downside to peptides?
So with any medication, there's always side effects, right? So the most common side effect with peptides that I hear from patients is when you inject them, you can get a little, it's called a histamine reaction, or almost like if you had a bee sting, where you get a little itchiness at the site of injection. Some patients can get with the GLP-1s, right? With the weight loss peptides, you can get some nausea, some bloating. That's part of the process of making you feel more satiated or full, so it's not necessarily a side effect, but a result of the medication. But overall, when used safely and dosed appropriately, they're overall considered to be pretty safe use. I call them injectable vitamins.
Okay. So is this something that people should ask their physicians about?
Absolutely, and the hard thing is this is a little bit on the fringe of medicine right now, and that's why we tiptoe around it. When anything's not FDA approved, we don't offer them fully as physicians, as licensed physicians, but I'm always in the endeavor of trying to study how to optimize my patient's health. And so it's something where if you ask your physician about it, they may not have all the knowledge or information, but they should be able to point you in the right direction. And do your own research, but definitely ask your physician, and you should be going through medical providers, not online sources.
Right. Okay, good advice. Dr. Michael Rossi, we sure appreciate you. Thanks.
Absolutely.
Thanks for coming in.
Yep.